Hello again, this is Ruth Harrison and I'm here to talk about evisceration and dehiscence of the wood, and I'm here to make us understand the differences between evisceration and dehiscence of the wood. And this is one of the operative complications that occur in clients after mostly abdominal surgery. So wood dehiscence is the separation of the wood edges at the suture line, and it usually occurs 6 to 8 days after surgery. Wood evisceration is the protrusion of the internal organs through the incision, and it usually occurs 6 to 8 days after surgery. So the difference is that for the dehiscence, it is the separation of the wood edges at the suture line, while the evisceration of the wood is the protrusion now of the internal organs through an incision, and usually this will occur around 6 to 8 days after surgery. Dehiscence and evisceration is most common among the obese clients and clients who have had abdominal surgery or those who have poor wound healing ability. Wound evisceration is an emergency. Whenever you have the protrusion of the internal organs post-operatively, then you have to treat this one as an emergency. Dehiscence is going to be manifested by increase in the drainage and opened wound edges, and also there are going to be appearance of the adherine tissues through the wound. While in evisceration, we are going to have discharge of serogenous fluid from the previously dry wound, and there is also going to be the appearance of the loops of bowel or other abdominal contents through the wound. The client reports feeling a popping sensation after coughing or with turning. What is the management of wound evisceration, and what are we supposed to do wherever we have an evisceration in a wound? We have to ensure that we call for help and ask that the surgeon be notified that the needed supplies be brought to the client's room. And once you notify the surgeon or you call for help, remember when you call for help, the whole team is going to come to help you. So ensure that you tell someone to notify the surgeon of what is happening, and you can also ask the other team members to gather the supplies that you require. You have to stay with the client. Don't go looking for supplies, and wait for other team members to bring the supplies to you. While waiting for the supplies to arrive, what do? You have to place the client in a low phallus position with their knees bent. And then you ensure that you cover the wound with sterile normosaline dressing and keep the dressing moist. Take vital signs and monitor the client closely for signs of shock, and prepare the client for surgery as necessary. Document the occurrence, the actions that you've taken, and the client's responses. Remember, it is very important for you to stay with the client so that whatever happens to the client, you're able to record. So this is the difference. That is how a dehiscence of the wood would look like, and the evisceration of the wood would look like this. So you can see that in the dehiscence, we don't have the protrusion of the abdominal contents, but in evisceration, we have the protrusion now of the bowels. So that is the difference. Very important, and it is a postoperative complication that occurs in clients, mostly those who are obese and those who had an abdominal surgery. So kindly subscribe to this channel so that you can continue learning about more and more management and nursing care in clients that you may experience in the future. Thank you so much. Subscribe and like this video, leave a comment. We're also going to appreciate. Thank you so much.